Hi, I am Kimberly Gabriel, and this is my presentation for the final assignment for nursing care and management of chronic illness and disability. The objectives of this presentation are to discuss illness experience and quality of life, coping and stress management, loss of power and intimacy, spirituality, education, models of care, integrative health, and health policy. My name is Kimberly Gabriel. I am a registered nurse. I received my Associates of Science in Nursing in 2009. Before that, I worked as a nursing assistant. I spent my first 12 years of my nursing career at the bedside in an acute care setting. In 2020, I transitioned to outpatient nursing care and now work at a cardiovascular lab for the same hospital. I am the vascular procedure nurse, but I also perform cardiac testing such as nuclear and regular stress tests and transesophageal echocardiograms. As the vascular procedure nurse, I am a member of the Vascular Nurses Association and the Critical Care Nurses Association. As part of my hospital, I am the co-chair of the Outpatient Perception of Care team. I am also one of 9 members of my hospital's Future Leader program. In 2025, I plan to complete my Bachelor's of Science in Nursing, obtain my cardiovascular RN certification, and obtain clinical ladder status. The illness experience is different for a patient with chronic conditions as it is for acute illness. Living with a chronic illness is a complex and dynamic process. It is a process that includes the stages of acceptance, coping, self-management, integration, and adjustment. Chronic conditions can be physically limiting, be a mental illness, or the stress of being chronically ill can take a major mental toll. Frequently, chronic illnesses are unseen diseases such as autoimmune diseases or cancer. I have taken care of patients who do not look disabled and are verbally assaulted for parking in a handicapped parking. Social isolation is when a person does not have relationships or contact with others and has little to no social support. Some risk factors for social isolation include chronic disease or conditions, mental health issues, and long-term disability. Health-related quality of life is defined as the extent to which one's usual or expected physical, emotional, and social well-being are affected by a medical condition or its treatment. I used to work with a palliative care physician who would speak at length about the quality of life over the quantity, meaning that an end of life that is fuller but shorter is often better than one of prolonged suffering. In the case of a 60-year-old patient who recently suffered a cerebrovascular accident 3 days ago, I would assess their view on what makes for a high quality of life for them. Are they spiritual? How has their independence been affected? And what can we do to adapt and maintain autonomy after their CVA? Powerlessness is a profound feeling that at its core can result in many emotions, ranging from anxiety, fear, and uncertainty to hopelessness. Patients with a chronic illness are at an increased risk of experiencing a feeling of powerlessness. A 20-year-old client diagnosed with schizophrenia may have a feeling of powerlessness or loss of control. Some educational talking points for this patient and his family would be empowering oneself. Patients with a sense of self-efficacy, proficiency, control, and a renewed value sense of self are less likely to experience prolonged feelings of powerlessness. Each person with chronic illness will have a different definition for what intimacy means to them, as well as what it means to their partner. Intimacy in the typical sense of sexuality may change when someone is suffering from a chronic illness or disability. and it may only be related to physical contact as opposed to intercourse. A 31-year-old patient with a new paralysis of bilateral extremities is going to have difficulty with the traditional way of being intimate and will need to explore new ways to connect with his partner. These ways may change and develop as his comfort level with his disability changes. Coping is defined as to deal with and attempt to overcome problems and difficulties. A 54-year-old patient diagnosed with bipolar disorder needs to be assessed for how he is coping with his new diagnosis. He also needs to be provided with patient-centered care, including compassion, respect, and care that aligns with the patient's values. Education and intervention should focus on ways to increase the patient's control in their disease management. Self-management emphasizes the client's involvement in defining health and is condition-specific. Self-management is intentional, involves the use of particular processes, and can be affected by specific programs and interventions, results in specific types of outcomes, and is socially influenced. Self-management is one of the most important tools to optimize patients' outcomes, autonomy, and sense of power with their chronic illness. A 12-year-old patient with type 1 diabetes mellitus needs to be able to self-manage in order to live an independent life and to reduce complications from their diabetes. The patient's caregivers, as well as the patient, need to be able to independently check his blood sugar, as well as how to treat it and when to seek emergency medical intervention. Spirituality is not necessarily the same as religion. Religion is an organized system of beliefs and practices, while spirituality is a broad concept that oneself is connected to something bigger. When discussing care with an 85-year-old patient suffering from arthritis, I would want to assess where his spirituality currently is. Does he find comfort in talking about feeling of God's will before I decide on how best to guide him through his diagnosis? Depending on what the patient currently finds comfort in, I may suggest to him that he speak with his spiritual leader regarding his diagnosis. Best practice for client and family education is to start by assessing the client and family's baseline knowledge and willingness to learn. In the case of an 8-year-old client diagnosed with asthma, the nurse will need to educate the family as well as the patient, especially due to his age. Does the family have any previous experience with asthma? What barriers do they have to receiving the information and following the plan of care? And then to help reinforce the plan of care with the patient and family. Social support is the relationship of support with family, friends, and the community, and has a significant relationship with one's health. A 14-year-old patient with depression may need intervention of seeking social support. It may be hard for this patient to discuss his or her depression with friends, and they may feel that their family doesn't understand. An online or in-person support group may be beneficial in this case. Adherence, according to the World Health Organization, is defined as the extent to which a person's behavior, taking medication, following a diet, and/or executing lifestyle changes, corresponds with agreed recommendations from a healthcare provider. Some of the barriers for a patient's adherence to a treatment plan can be multiple chronic conditions, multiple providers, and polypharmacy. It is important that patients understand the risk and benefits to their treatment plan and that they agree and not just blindly follow. A 21-year-old client diagnosed with obesity needs to understand his or her own risk factors associated with being obese, as well as what options are available to adhere to a diet, exercise, and treatment plan. Culture is defined by Purnell as the totality of social transmitted behavioral patterns, beliefs, values, customs, lifeways, arts, and all other products of human work and thought characteristics of a population that guide their worldview and decision-making. There are health disparities amongst individuals with chronic conditions as well as different races, cultural backgrounds, and sexual orientations. It is not enough for nurses to just recognize or document these. Nurses must advocate for these patients. All patients must be the center of their plan of care. A 27-year-old Black client with sickle cell anemia must be seen as an individual and educated on his disease and how to manage day to day. He must have equal access to adequate care and resources. Family caregiving can be an exhausting labor of love, one that many people cannot understand until they have lived it themselves. In this case of a caregiver who works part-time and has 3 children, one of whom is a 5-year-old with autism, they need to educate on how to balance their home and work duties without burnout. One of the best resources is to have a social support system to talk to. Their support system can be family, friends, and a more formal support group. They also need social support in the form of help in the home. The caregiver may also need assistance with healthy coping and stress relief techniques like meditation or journaling. The chronic care model is a comprehensive team-based model that aims to redesign primary and specialty practice. The model includes 6 essential factors in managing chronic care: the community, the health system, self-management support, delivery system design, decision support, and clinical information systems. This differs from family-centered integrative care, which is an approach that integrates the family into treatment plans and care decisions. Medicare is a federally funded healthcare program for people over the age of 65 or with specific chronic conditions under the age of 65. Medicare is also partially funded by their participants with monthly premiums. Medicaid, however, is a state and federally funded program for people with limited income and offers some services not covered by Medicare, such as nursing home care. A 50-year-old client diagnosed with COPD may not qualify for either service. If he is still working, he may have private insurance through his employer. If he is permanently disabled by his diagnosis and does not have residual income or resources, he may qualify for Medicaid. As a nurse, I explain to patients that primary care is the umbrella covering all of their comorbidities and chronic illnesses. Primary care encompasses prevention, early detection, and management of chronic illness and can lead to increased quality of life, decreased disability and suffering of patients. Registered nurses in primary care may perform many functions, including medication and immunization administration, supervision of unlicensed personnel, medication reconciliation, patient and family education, patient flow coordination, as well as on-site telephone and electronic triage, advice, and guidance. They also may help coordinate care and testing outside of their facility. A 45-year-old patient diagnosed with recurrent cancer will benefit greatly from a nurse coordinator. This patient will need many different services coordinated in a short period of time, as well as education and follow-ups from each. Different services range from surgery to chemo and radiation, a port insertion, laboratory and cardiac testing, additional cancer surveillance. It is a lot for a patient to keep track of and often entails multiple healthcare providers. The role of community care nursing is defined as promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. A 75-year-old patient with Alzheimer's dementia may benefit from tertiary prevention with the assistance of a community health nurse. A nurse can assist with resources on how to keep the patient safe in their own home as long as possible through available programs such as Meals on Wheels or medical alert systems, adult daycare or memory care programs. Post-acute care refers to care provided after an acute care hospital stay. This can include a long-term care facility, a rehabilitation facility, home health agencies, amongst others. A 16-year-old client recently diagnosed with cystic fibrosis will need multiple services post-discharge, ranging from education and follow-up upon their diagnosis, eventual oxygen therapy and breathing treatments, and physical therapy depending on how long they were hospitalized for. For such a young patient, I would typically recommend home care services as long as the family is a strong support system. Palliative care and hospice care are not the same thing. Hospice refers to care for patients expected to pass away in less than 6 months. Palliative care is an approach that improves the quality of life of patients, adults and children, and their families who are facing problems associated with life-threatening illness. It prevents and relieves suffering through early detection, correct assessment and treatment of pain and other problems, whether physical, psychosocial, or spiritual. Thus, palliative care includes following services or actions: provides relief from pain and other distressing symptoms, affirms life and regards dying as a normal process, intends neither to hasten nor to postpone death. A 90-year-old patient diagnosed with incurable cancer and is expected to live more than 6 months. This patient may still benefit from specific cancer treatments that will prolong his quality of life. It is very important to consider the risk of suffering very carefully when deciding an appropriate plan of care. Complementary medicine is when a patient has an incurable disease and utilizes non-mainstream medicine in conjunction with mainstream medicine to ease their symptoms. A 52-year-old patient with amyotrophic lateral sclerosis wishes to include herbal therapy in their care. He must be educated on a few points, such as what are the risks and side effects of the herbal treatment he is seeking. Will the herbal therapy interact with his current treatment plan? What does he expect to gain from adding the herbal therapy to his treatment regime? It is also very important that he informs his treatment team of any new herbal supplements he is taking to ensure there are no interactions with his medications. For individuals with chronic illness, access to high-quality healthcare services that are safe, effective, patient-centered, timely, affordable, and equitable is critical. Unfortunately, this is not always the case for patients with chronic illnesses and disabilities. Over the past few years, with the addition of the Affordable Care Act, access to quality health care has been easier for patients, but not always equitable or affordable. Nurses must stay up to date on current policies and contact their assembly members to put new bills into action to assist patients with chronic illnesses to have the support they need. The number one stakeholder in this are the patients and their families. Having a chronic illness can be overwhelming and leave a patient feeling powerless. Knowledge is key in staying hopeful and self-advocating. It is incredibly important to have a solid support system and a care coordinator that you trust. It is beneficial to have a spiritual relationship to fall back on.